everybody. We will go and get started with our March Advocate webinar series. The web series is a series of 30-minute calls highlighting an issue or an advocacy tactic that we use to help further the cause and really get arthritis out in the forefront. So this one is going to be really great. We have Anna Lagasse, who's a longtime Arthritis Foundation ambassador from Boston, who's going to talk to us about the power of social media and how you can use social media in your advocacy work. We're having, let's see, our next Advocate webinar series, just mark your calendars for this, April 19th. We're going to be talking about how to recruit more advocates at your local block. And we're joined by Heidi Barrett from Washington State. So let's see. Social advocacy are super important because even a few comments can get the attention of elected officials, and even one person commenting can be enough to grab the attention of an elected official. Are generally misunderstood, so we really need to tell our story in a compelling way on social media to really raise awareness about arthritis and that it affects so many people. So I also need to hear from you, and social media is a great new way to let your voice be heard rather than just sending a letter or giving a phone call to your elected official's office. So with these points in mind, without further ado, I will let Anna Lagasse share her story and a few tips on how to be heard on social media and some effective ways that you get involved. So, Anna? All right. Hit pound 6 and you'll be unmuted. See if I do this.
Can you?
Yes, yep. Okay. I thought I had to go that way.
No, I'm excellent talking on mute professionally as well. So, well, thank you, Laura. Thank you, everyone, for joining today. Speaking of work, I know that this is within the workday for many of us, so I really appreciate everybody who's able to be here. As I mentioned, I've been part of the ambassador program for a while now, and I actually attended my first summit back in 2015, and my favorite session I had gone to at that summit was about social media and advocacy, and that was really my introduction. I could use Twitter and Facebook and even Instagram in certain spots as really effective advocacy tools. So I have a Twitter account until then because I just thought Twitter was going to be a passing thing. So I actually think I started my account right at the first summit, which is really a cool thing to look back on because since then I've actually delivered social media and advocacy talks at the summit and helped people set up their Twitter accounts too. So it's fun to see things come full circle like that. But to give you an idea of how powerful social media can be in a lot of different ways, just a few months after the summit, and Laura is very familiar with this story, I was going through pre-authorization to get on Orencia infusions, and I'm sure is shocking to none of you here, I was actually rejected the first time that we tried to start treatment. And, you know, I knew the appeals process, what that entailed, and I was so frustrated, and I got online, and I just started tweeting my insurance company. And it wasn't just my tweets, but it was the retweets and the responses and the conversation that my followers generated around that really got attention of my insurer. And story short, about 24 hours later, I had the denial overturned and was getting ready to schedule my first infusion. So it wasn't directly related to the advocacy work that we do here at the foundation. That was a big learning experience for me as far as how effective even just a few tweets could be once they start to gain momentum. So fast forward about 2 years, and I built a bit of a following on Twitter and have really been able to leverage that with our advocacy work here. And most recently, just to give you guys an example, I know that we all have a lot of concerns around the repeal of the Affordable Care Act and now what we know to be the replacement. And this is a really important area in which we need to be sharing our stories right now to really create a tangible connection for how this legislation really affects our day-to-day lives. Now, I'm lucky enough to live in what would be considered a very blue state in Massachusetts, but it's still, even if that's the case for you, it's still really important for your elected officials to continue to hear your story, even if you already feel as though you have their support in this fight that we're a part of. They need to continue to hear your story as a reminder for what they're fighting for and the work that they're doing, and also be able to provide their colleagues who are on the other side of the fence or the aisle, as it may be, sort of being able to make the same compelling connection. So recently, I'll give you a little bit of example of what I've been doing. So it's only March, and I have billed close to $60,000 to my insurance company already, and many of you are in a similar boat. And so periodically, it's an updated total of what I've billed, and I do it through the lens of I have billed X amount of dollars to my insurance company. If time caps came, we're back, I would cap in $1 million plan in X years and be without care. And that makes a really tangible connection, because the limit I've done is I would be out of insurance by the time I was 35. And that's a really scary thought for me and other patients, but also the really simple argument to our elected officials about really the tangible ways that this will affect us. I also use pictures, and as cheesy as it is to say a picture is 4,000 words, they're so impactful. So what I'll do a lot of times is, if I'm at the hospital receiving an infusion or a joint injection or some type of treatment, I will take a picture and I will tweet it to my reps and let them know that this is the kit I have access to because of healthcare as it exists today. And to take it one step further and to get away just from treatment and the healthcare space, by the pictures that Laura has up, there is a picture of me with my very first Spartan medal for my first Spartan race, which is a really incredible day for me. I was at one point told that they would never walk, let alone run. That was really powerful. So I will tweet after races as well, again, right to my elected officials, to show them the things that I'm able to do and the quality of life that I'm able to have as a result of my access to treatment. So a lot of different ways and different angles that you can tell your story from. There's certainly no one-size-fits-all for advocacy. I'm very transparent, and I share a lot on Twitter and in other areas of social media, but you can pick what's right for you as far as the level of your personal story that you feel comfortable sharing. And so what's great about this is that I'm also a frequent caller of especially my representatives, not necessarily my senators. It's very difficult to make headway at Senator Warren's office, as you can imagine. But my local rep, I talk to their local office at least once a month, and a lot more around the different recesses and when I'm really looking for local meetings. And I will get on the phone and say, I already tweeted you guys about this meeting, but I'm just calling to follow up. And some of the staff there, depending on who answers the phone, have actually started to make the connection between my Twitter handle, 6HIP, me calling the office. So they are paying attention. You're not always going to get that person on the phone, but the accounts are very closely monitored, and it really can take as little as 5 or 6 or 10 tweets to get the attention of an office. And just, to think about arthritis being a very misunderstood condition across a variety of different fronts, your advocacy that you do on social media, even if it's directed at your representatives and at your senators, will begin to raise awareness in other spaces. So for me, I've been really lucky to get the attention of, different runs and different races that I've run with, or that I tend to run. Even this national podcast that I listen to, just because I keep tweeting and tagging them, a variety of advocacy efforts. So I've had the opportunity, even outside of the sphere of my own social media, to link up with different companies and different people and tell my story and be featured on different websites as well, which is something I really just never, ever thought a couple of years ago would be an opportunity for me. So there's a lot of different ways to get to your elected officials, and the downstream effects of that are the opportunity to tell your stories in different venues and really raise awareness on a much bigger level than I think certainly ever thought was possible when I first started. So that, I know that's a lot, and I talk really fast, and I tend to just put out a whole information. And I didn't know, Laura, how I wanted to keep this really conversational, so I didn't know if you wanted to do any questions or if you had any questions or anything else that you want me to expand on.
So what would you tell somebody who is beginning to start on social media that might not be that familiar with it? What's the best way to get started?
That's a really good question and something I meant to touch upon. So as part of our advocacy with the Arthritis Foundation, we use the hashtag Advocate for Arthritis, and I know that it's elsewhere in this presentation. And so a really good way of getting started and connecting with other people that are already part of this conversation is to go on Twitter and search for the hashtag. And when you click it, you can organize it a couple different ways. You can click the top tweet and sort of see the widely shared and the most impactful tweets with that tag that are out there. But you can also click and see latest, and you can see real time across the entire Twitter sphere, I guess as they'd call it, who is tweeting Advocate for Arthritis. And so this is a really cool way to connect with other advocates and follow them, sort of to build a little community for yourself within Twitter as far as making friends and having some support, but also a really good way to see how other people are using the hashtag and the types of things that they're sharing and how they're connecting with their officials. So it's kind of, to me, it's like a tweet sheet. I didn't even mean to do that. I was going to say a cheat sheet, but it is. It's like a cheat sheet, and you can see what other advocates are doing. You don't have to reinvent the wheel. You can share what's already being said. You can share and quote it and add your commentary if something that you support or a situation or experience that you've had as well. So that's a really good, a good place to start if you've never actually gone online and sent a tweet, is to sort of use other people's and join the conversation that way.
Great. So I have a question online. Have you ever felt that maybe you've been too transparent on social media, or how do you really figure out what to post and what not to post, or posted something and you're like, that was a little maybe too much or too little, or what do you think about that kind of thing?
So something I did way back when I started all of these accounts, my blog, was I created a whole separate address and sort of online paper trail so that if you were to Google my first and last name, you'll actually only find my professional Twitter account and not the one I use to advocate for arthritis. You can find, to be perfectly honest, I don't think you can even find my blog kind of just with Googling first and last name. So to say that is I think the biggest struggle that some people have, and I've had, is if you're a professional, if you're working, and either you're worried about disclosing your arthritis affecting your career or you haven't disclosed, there's certainly a line and some privacy that you may want to protect over that. If anybody, my Twitter handle is out there on this presentation, so if anybody ever wanted to reach to me directly, get a little bit more about some of the decisions I've made relative to privacy, I'm certainly happy to offer any help and get away from advice, but at least experience. That said, I really made a decision a while ago to put it really all out there, the good, the bad, and the ugly of this disease. I've found it to be very effective, both in awareness and in creating the support system for myself. So I'm able to say that it hasn't, I haven't really seen any negative effect from doing so. I know like that's kind of a non-answer, and I don't mean it to be. I just this is a decision that I made for myself, and it's certainly not for everybody. But I put a lot out there. There was a picture of me getting my knees injected in my surgeon's office. You can find a picture of me tweeting from the couch with an ice pack on the jaw from a flare. I really wanted to put my face and my experience out there as an embodiment of what this disease can do, especially over the course of 20 years. So it's a non-answer, and I don't mean it to be. And like I said, if you ever ask that question, my Twitter handle is there, and you should feel free to reach directly if you want to have more conversation about that and my experience. But I can say it's really been largely positive for me.
That's pretty helpful. I know it's up to a lot of people what their preference is. I know me personally, I have a personal Facebook and a professional Twitter and a personal Twitter. And yeah, if you went to look for me on personal Twitter, no one would really find me. And basically all I do on that personal Twitter is complain about the Metro. So it's not interesting even if people wanted to find it. So when you use social media, what are some pointers that you can give people about Twitter and Facebook and maybe some of the rules of thumb?
Something that's really important to remember, two things. I think tagging is really important. So when you're tagging your elected officials on Twitter, if you're your handle, so let's use Elizabeth Warren as an example, just because we all know who she is. In order for people to see that tweet other than her, you have to put a period in front of it. You go, Elizabeth Warren, please, please don't rebel the ACA, whatever you want, whatever language you're using. That period that's there in front of Arthritis Foundation in this, in the presentation ensures that everybody who follows you on your feed will see it. On Facebook, something I've been trying to correct across the board is you are posting on your personal Facebook, which is private. Like mine is so locked down and private unless I decide to make a post public. You tag Elizabeth Warren, notify her account, and whoever manages that account will get a notification that they've been tagged, but they won't be able to see your post if your notification settings are private on that post. So it's more effective to go directly to your representative's Facebook, share what it is that you want to say. And the good thing about that is that it makes it a public comment, so other people can also engage and lend their support and lend their experiences. So if you were to go and post your story on your representative's Facebook and 2 and 3 or 4 or 5 people even liked it or commented on it or even shared it, you can get sort of raise the profile of that particular comment and get a lot more traffic. But again, it does make it a public comment. So I don't encourage that at all, and I'm a frequent flyer on my representative's page. But as public, you certainly may want to be more judicious in what you want to say and how personal you want to get with that share. The reason I'm calling out that differentiator is simply because if it's just on your personal Facebook feed, your representatives won't be able to see it. And this is for if you're trying to reach an insurance company or anything else. It's not enough to tag them. It's really posting directly to their page, which will get their attention.
That's super helpful. Have you ever made videos, and what kind of advice would you give to people that might want to make a video?
I've just started making videos using Instagram Story, and so this is a little bit different. This is more Instagram I use in a little bit more of a personal way, but I do it. So I'm in the middle of a really bad pericarditis right now, which is it's inflammation in the sac that lines my heart, and it's pretty uncomfortable. So I've been kind of posting some video diary updates to, even within our patient community, help others to understand the systemic effects of arthritis. So, in that, because I'm using this as kind of a pilot, I don't like how my voice sounds recorded. I'm fighting the urge to put makeup on every time I record one of these. So this is sort of my foray into video making, because what I want to do is do something bigger, do more of like a YouTube video diary like this that can be easily and more publicly shared. To videos right now.
Very cool. Yeah, I didn't even realize, I know Instagram has the video feature and everything, but it's really something I haven't personally gone into. It's a fantastic tool, as well as, Twitter videos. And that we've done at the Arthritis 101 briefing and actually at the Advocacy Summit is that we've gone live. So have you gone live yet, Anna?
And mostly I'm worried that I will get nervous and I will swear or say something inappropriate. I'm a liability to be live. To be perfectly honest, even with my Instagram videos, if you see one video, I probably recorded it 10 times before I posted it. So I think live is awesome. I loved the live Twitter feed of the trivia session that you guys did at the summit. It was really cool to actually get to watch it even later after the fact. But for me, kind of like the idea of having the time to maybe jot down a couple notes and, sit in front of a nice black background like what we have on the screen and be a little bit more thoughtful and polished in what I want to say there. Here, if any of you guys, just to shout out to a fellow advocate, if any of you guys follow Mariah's Movers on Facebook, his mom, Tori, goes live frequently, and it's awesome. It's good days, it's bad days, it's methotrexate shot night. It's a really, really honest glimpse into life as a kid with arthritis, and I just love it. I think if you check out Mariah's Movers on Facebook, they are she runs such a great page and is a great person to learn from as far as those and going live. And Tori, Mariah's mom, is like a social media rock star. So she's a really, really great advocate and resource to learn from.
Great. I have about 8 minutes or so. Any else on the webinar have any questions, or anybody on the phone? If you do have a question on the phone, just hit #6 to unmute your line. We have our chat feature, our Q&A feature. On here, what is your favorite part about social media? Why do you continue to use it as you do?
For two reasons. One, it's so accessible even on your worst days. Given that I'm not having very good days right now health-wise, I like that I can still get on my phone or get a laptop and tweet and share about that and continue to tell my story, and I don't even have to leave the house to feel like I'm making my voice heard, which I think is, for me, been a really helpful way of coping with these not-so-good days. I've also met a ton of friends. I was at the summit this year. There was people that I've been tweeting to and following on Instagram, from age 19 and in college to a woman in her 60s. There's a community of support out there, too, that I had no idea existed until very recently. So I feel really, really lucky that when I share some of the tough days, I'm not just doing it to advocate, but I have, a group of friends and people out there who will really reach out and encourage me and support me. I make sure I check in and do the same, which is really nice to just not feel, alone or isolated, especially on these, like I said, not so great days when I'm not leaving the house at this point, but I still feel like I have friends and like I'm making my voice heard and I can still have an impact, which is really, really powerful thing for me these past couple of years.
That's wonderful. We have one more question before we wrap up. The government is pretty divided. America is pretty divided. when you do political postings, what general rule of thumb for making sure it's nonpartisan? And what do you do if you see someone on social media, really ranting against a member of Congress or an elected official?
So it's the thing. Government might be divided, our parties might be divided, but that doesn't really change my story or how a repeal can affect me. Having been within the healthcare system since before the ACA, I can speak from experience of knowing what it's like to cap my family's insurance plan. So it didn't just affect me, my care, it affected my mom and my dad and my two sisters as well. And I can tell that story in a way that's very matter of fact, and they're just the facts, people. This is what happened. The cap, affected our ability to access health care. My parents had to pay for out-of-pocket costs. It affected our ability to afford other things that our family needed. So they're just facts, and they relate to healthcare, and they create a tangible story around the impact of this repeal specifically. So I try to keep it at the level of my story and make a tangible connection. And that, to me, is pretty bipartisan. I interpret that as being, more for one party or the other. That's on them, but I don't. I don't specifically anything a party to. My general rule of thumb for people that do is just I don't engage. I've never. My dad over the other day visiting. We are very, very different political thinkers for 2.5 hours, and I certainly don't think I've made any headway there in those 2 hours or the last 20 years. So if you apply that same logic online, you're not going to change somebody's mind either on Twitter or on Facebook. So I just don't engage, and I do tend to be a little bit careful. In art is kind of essential to say, but who I associate with. If I see somebody that's using really divisive language or tactics or being very aggressive or abusive in the way that they're trying to make their case, I tend to just sort of disengage and unfollow across the board so that I can make sure that, my message still is told in what is an appropriate and in an impactful way, and that I don't have any sort of detraction from that.
Great. That's definitely something that we encourage. Arthritis knows no political party, and telling our story is a powerful way to really help all people with arthritis rather than, making a bad impression or alienating somebody from either party, because then everyone's affected by arthritis.
I'll say one last thing, Laura. I think when you can do that, when you can just stick to the facts and telling your story and trying to make people make the connections and understand how policies affect people. I actually had family members on Facebook out and say, I had no idea, or I didn't realize, or I thought because I had employer-based insurance or whatever. And I didn't know how it oops, hear me? Oh, sorry. But you can have more impact that way, and you might unintentionally sort of change minds that way. It's effective, and it's a way to keep everything very positive.
Yeah, positivity is definitely key to getting messages through. All right, thank you so much for joining us, Anna, and thank you everybody on the webinar and on the phones. We really appreciate you all taking the time of your day to join us. And I accidentally gave you the wrong date for the next Advocate webinar series. It's actually April 26th, 3 p.m. Eastern, 30 minutes on how to recruit advocates at your local event. So thank you again, Anna, and you're wonderful as always, and we love having you on to give us your experiences and advice, and just a fantastic ambassador. So thank you so much.
And thanks everyone for being here today. You guys can find me on Twitter at 6hips. Please, please, please never hesitate to reach out. I'm always happy to make a new friend or help you guys find your voice the same way I did. So Hope everybody's feeling good today, and we'll talk to you all in April.
Great. Well, have a great afternoon. Bye,
everyone.